Cleft lip and palate is the most common congenital abnormality that occurs in the head neck area. It's about 1 in every 600 births. It occurs different. The incidence is higher or lower depending on your ethnicity. There are some things that have been connected with the development of cleft lip and palate, but most of it is multifactorial, meaning that there are a lot of things that have to happen in order for a baby to be born with cleft lip and palate. And most of those are out of the control of the mother and the father. When patients are born with cleft lip and palate, there are a myriad of things that have to be considered, from the appearance to feeding to breathing. Hearing is affected. These patients have more likely to get ear infections and because of that have issues with hearing. It's a real good example of the importance of a multidisciplinary approach to treating care. It's probably one of the first conditions that a team was developed to help provide optimum outcomes for these patients. The thing that I enjoy most is that you have long-term follow-up and connection with the families. Like I said, I have parents that contact me for different milestones. They all have my cell phone number, and so I'll periodically get texts with pictures and stories. Usually we start treating these patients around 3 months of age, where we fix the lip, and then around a year to year and a half, we fix the cleft in the palate if it occurs. After that point, we follow the kids. Sometimes there's issues with speech that require other interventions. The patients a lot of times need to have dental procedures and orthodontics. And when they're in their teenage years, sometimes we have to repair, we have to touch up or fix the nose. There's a nasal defect that's associated with this, and after the face is done growing around 16 years for females and around 18 years for males, then we do what we call a definitive rhinoplasty, where we try to touch the nose up and make it appear and function the best that we can.